Dr. Garima here again, and we'll be continuing to solve the further practice exam question papers that ADC has recently released. In our last video, we had solved scenario 1. Today, we are going to solve scenario 2. Interesting scenario, very commonly asked scenario, and at least one Sjogren syndrome question can be asked in your exam, as there is abundance of old population in Australia, so you will encounter people over the age of 70 and the lifespan is good. So you can expect people from the age range from 70 onwards till 100 and 110 also. And with age, many changes happen in the body. Some of them are related to the oral cavity, and Sjogren syndrome is a pretty common syndrome, along with osteoporosis and patients taking bisphosphonates for maintaining their health and lifestyle. So these things also affect the mouth as they change the quality of the saliva. They decrease salivary production, they decrease healing capacities, so teeth obviously get affected, and when the patient comes to you, you have to be aware of all these factors. As a natural normal healing process may not take place in such patients, they may require more preventive care to the same caries risk factors which are not producing any result in a young patient but produce very destructive results in older people. So that's why you need to be aware of all that, and hence such questions are asked in the exam to test your knowledge, correct? So let's get on with it. Betty, a 70-year-old female, comes to your practice for a checkup. So this question basically is a combination of oral medicine symptoms like subject, plus caries risk assessment, plus preventive dentistry, plus minimally invasive dentistry, all these things, okay? So different topics of dentistry, different MCQs are taken and they are clubbed together and a scenario is formed. That is how this question works, that is how ADC exam works. So yeah, Betty, a 70-year-old female, 70, okay, the age is important here, comes to your practice for a checkup. You learn that Betty is recently widowed and lives in a residential care facility in an area with fluoridated reticulated water. What do you mean by the term reticulated? It means there is a appropriate adjustment of fluoride in the water to suit the residents, and so that appropriate amount is there, not extra, not less. That means reticulated. Very important keyword here, it means that there is fluoride in water. Upon questioning, you discover that even though that there is reticulated fluoride water supply, Betty still prefers drinking bottled water rather than tap water, as she does not like the taste. Bottled water may or may not have fluoride. You have to see on the labeling of the bottled water. Normally, they do not have fluoride, or they have extremely less concentration of fluoride, which is negligible. So unless the fluoride mentions on the label as 1 ppm, anything which is less than that is useless for you, correct? So here, by default, you have to consider that the bottled water is not having fluoride, because in general it does not. While taking a patient medical history, you learn that Betty has Sjogren syndrome. What is that syndrome? Decreased salivation. There can be decreased secretions in the eye as well, but mostly it is decreased salivation, and there are other problems with the salivary glands, but our main concern is there is decreased salivary production. Your examination findings reveal multiple root carious lesions. You opt to do a saliva test and discover that Betty has viscous saliva. Viscous saliva is always related to thick, ropey kind of saliva, which kind of sticks to the teeth. It's not like the watery thin saliva which helps in cleansing the mouth. She also has low salivary flow and low acid buffering capacity as well. See, saliva in the mouth is like the best friend to prevent cavities. You know, if you have abundant quality of saliva and high buffering capacity, basically it helps to neutralize the acids produced from the digestion of food faster, and a good flow rate. Then such people, you know, you must have heard like many of them saying that, you know what, my friend eats chocolates all the time but doesn't end up with any cavities, and I barely eat one but still I end up with so many. And then when you check their mouths, you see that the friend has copious amount of thin watery saliva. Like you just open to examine and there is like saliva drooling out. And their buffering capacities are nice, the salivary flow rate are nice. So the saliva automatically is like a 24/7 cleansing mechanism for the teeth. And for those people who have thick ropey saliva, even in young age, as young as 24 and 25, they end up with straight, rapid progressing caries in the pulp. The teeth are destroyed, the mouth is horrible, and then you're like, what happened? And the patient is like, trust me doctor, I do not eat sweets or any sugary stuff, and still my mouth ends up like this. That's how important saliva is. So when specifically the question is mentioning that you have viscous saliva, low salivary flow and low acid buffering capacity, you are going to end up with caries. And in old age, because there is recession of the gingiva, root is exposed, the root is more rougher than enamel, it will catch caries pretty fast and it will reach dentin very fast, because cementum is not so thick as enamel. Cementum can get destroyed and then immediately dentin starts to get destroyed. A typical root caries scenario in old age people you must have seen. So now, having been aware of such a scenario that in your cards you have something where saliva is not helpful to you, also the patient is drinking bottled water, not tap water, so fluoride is also not there, how are you going to manage this patient? Okay, so what is the most common, most important part? Most adjectives, most means just pluck the most important thing, the rest are also important. I have to take the most important thing. What is the most important part of Betty's patient history to consider when determining Betty's caries risk factor? What is the risk factor? The factor which is going to produce the most risk. What is the most risky situation here? Is it her socioeconomic status? No. The question, why this option is there? Because they said that Betty is recently without. You don't know who's supplying her finances. Is she working? Was she supported? No idea. But is that the most important risk factor? Preference of drinking bottled water. It is a risk factor, but most important? No. High carbohydrate diet. Nothing is mentioned in the scenario about diet, so don't jump onto it. History of Sjogren syndrome. Yep. Loss of interest in personal care. No, it doesn't seem like if she had loss of interest in personal care, she wouldn't come for a checkup. She would have come if there was a problem. But the question says she's come for a checkup. Also, she brushes, correct? So that is not mentioned that she's not brushing or something like that. No. So loss of interest in personal care is not the right answer. So I will go with history of Sjogren syndrome because that is my most important risk factor. No matter what external things I do, if her saliva stuff is not sorted out, caries will continue to happen, right? And that is my most important risk factor. So is my answer. During examination, you found a white spot lesion on tooth 1-1, central incisor. At the cervical region, you noted that this non-cavitated lesion, you just see a white spot, was easily detected on wet enamel. See, there are some white spots where even if you dry, when you dry the tooth, only then you can see, but when you wet the tooth, it disappears. And there are some white spot lesions which are a little advanced stage, where even on wet enamel they are visible, meaning they are soon going to be cavitated, but they are not yet cavitated. And because they are not yet cavitated, they still have the potential to remineralize themselves. Yes. So if you provide proper fluoride or calcium over that area, they have a huge potential to remineralize. So such areas you should never probe, because you will create a cavity as they are weak, but they can be made strong by application of proper stuff. So in addition to providing oral hygiene instructions, what is the most appropriate management for this lesion? Restore the lesion with GIC. You're not going to drill this. Apply minimally invasive dentistry methods. Minimally invasive dentistry resource has been mentioned by ADC. I have made MCQs on it and I have published that in my Ultimate ADC book. One of these MCQs has been picked up and used in the scenario. Understood? When you read a lot of MCQs related to one topic, you will find that the scenario-based questions which the ADC has made has taken MCQs with 5 different specialties related to the same topic and clubbed it into a scenario, giving you a comprehensive feel of, being a wholesome dentist. You understand? So if that's what I was just explaining one of the candidates today when he was asking, they are scenario based questions while your book has MCQ based questions. I was like, listen, if you know how to read alphabets, English alphabets, you can form any sentence. But if you don't understand the alphabets, you cannot mug up the sentences. Understood? So I can just take question number 7 as a single based MCQ and form 10 different questions of Sjogren syndrome, and then I can form one scenario and I can take one MCQ from each dental specialty like perio, endo, prosto, which is related on Sjogren syndrome, and club it into a scenario based question. But to answer this topic, I need to understand Sjogren syndrome, right? So I need to study that separately. That separate thing will have another set of MCQs. That is what the book is about. It will strengthen your basics. If your basics are strong, then only you can answer these kind of questions. Correct? So anyways, let's just move on. Where were we? Oh yeah, there was a white spot lesion. So what are we gonna do? Minimally invasive dentistry. Restore the lesion with glass ionomer cement. That would require drilling. No. Topical application of a remineralizing agent. Yes. Recommend use of a salivary substitute. Not wrong technically, but the question here is specifically asking what is the most appropriate management for this lesion, not the entire caries state or the buffering capacity of her saliva. So for this lesion, I would prefer a remineralizing agent. Monitor the lesion at a 6-monthly recall. What I will do monitoring it? I have to do some changes I have to help that lesion remineralize. So just looking at it with my eyes is not gonna do anything, right? So topical application of a remineralizing agent is the right answer. Now what are those remineralizing agents? Fluoride, tooth mousse. Tooth mousse has CPP, ACP, that is calcium phosphopeptide, amorphous calcium something. I forgot the name. I think I'll get it while discussing the other questions. But yeah, CPP, ACP is the right answer here. GC tooth mousse is the best option. After that, I would go with fluoride. Casein phosphopeptide, amorphous calcium phosphate. Yeah, I think that's the full form. Now, Betty mentions that she brushes her teeth with a fluoridated toothpaste every day. In addition to brushing and flossing, what is the most appropriate supplemental is adjunct, oral care regimen to recommend to Betty to manage her caries risk? Okay, so she's using fluoridated toothpaste, but she's not drinking water from the tap, so she's getting fluoride from somewhere. So what else am I gonna tell her? Casein phosphopeptide, amorphous calcium phosphate cream. Look, I was just talking about that and it's just come. That's GC tooth mousse basically. Yes, this is the supplemental additional thing that you're going to tell her, because this is a concentrated form of chemicals which is going to help her with her caries. Bicarbonate mouthwash, no. I mean, you can use once in a while, but you cannot recommend it on a daily basis. 9000 ppm fluoride mouthwash. It's not a wrong answer, but they haven't mentioned here how many times, and you cannot use it daily, it would be too much, so no. A salivary substitute, again, salivary substitute is very helpful, but it is not what the teeth needs. I mean, the teeth definitely need cleansing of the saliva. Salivary substitute is not a wrong answer. I mean, I would also give it as a supplemental oral care regimen, but if I have to choose the most appropriate, then I would go with GC tooth mousse, that is casein phosphopeptide, amorphous calcium phosphate, CPP, ACP cream, because that is a very pure form of concentrated tooth mineral-like structure which is going to strengthen the tooth. Saliva will overall help, but it's not going to remineralize the tooth structure. It is the calcium which is going to do that. So if I have an option of specifically giving that, I'm going to choose that. But if option A was not mentioned, probably I would have jumped to option D, because it's not wrong either. But if I have to choose the most appropriate one, then that is the most appropriate one. Now, what is the most important action to take to decrease Carey's risk for Betty? Most important action. This most word just kind of drains you out, because all the options are correct, and in instructions you will give all these options to the patient, but you have to choose just one. This is not fair, right? Provide education in plaque control. Well, the question is not mentioning that she actually has plaque, so I'm not going to go with that option. Provide advice on how to alter modifiable Carey's risk factor. Very, very good. See, if she is doing something in her diet and she's not willing to change it, then you can give her modifications of it so that she can reduce the chances of cavities. This is very important. If she continues to follow her own risk factors, then it becomes very difficult for you to correct the problem. So if you think one of the things that she is doing is leading to more risk factor, you can tell her alternatives of it so that she can modify those things but still continues to live her life. Encourage chewing sugar-free gums to increase salivary flow. This salivary substitute are also great options, but is it my most important thing? No. Conduct a dietary analysis. You can do that, but that is also not the most important action. See, all the 4 options are correct, but if I have to choose one thing, it's as good as saying, for example, when one of the parents says, my son eats biscuits, only one biscuit, but in between lunch and dinner, and he really needs to have that biscuit, So that is a risk factor, because he's having between lunch and dinner and he's not brushing after that biscuit. So that biscuit is basically sugar is staying for a long, long time in the mouth. But the child doesn't want to leave that either, and you don't want to tell them to leave it either because they really want to do it. So what do you say? How do you modify such a risk factor? You will tell them, okay, you know what, you want to have biscuit, great. Have it either at lunch or at dinner time, not in between. So they'll be like, okay, the doctor is not saying us no, they are letting us have the biscuit, but it's just that I have to change the timing for it. Or you just say, you know what, you can have the biscuit, but immediately brush after that. So they'll be like, okay. So what you did, you just modified the risk factor. You did not eliminate it. You understand my point? So conducting a dietary analysis is you understanding her diet, but you're not taking any action on it. The thing which is making you take an action is providing an advice on how to alter modifiable Carey's risk factor. So action is a word where you have to act. You understand? So option B is making you act and change something which is for the benefit of the patient, hence that answer. Tricky question. If you get confused between answers, it's not your fault. Like it is a tricky question, Now, when discussing Betty's preference for drinking bottled water, she insists that she does not want to switch from bottled water to tap water. See, at the example that I just gave, that my son wants to have a biscuit and I cannot say no to it. So Betty insists that I just want to drink bottled water and I'm going to drink that. So now, what is the most appropriate advice you would give to Betty regarding her water consumption? You cannot say no to it because the patient is insisting that they want it, okay? So option 1, she should continue to drink standard bottled water only. Option 2, she can add bicarbonate soda. Option C, she should drink bottled water containing fluoride. And D, she should drink bottled water containing the word mineral on the label. Okay. Option A and B are out of the window now. C and D. Well, what do you want? You want her to have fluoride. And if the option C is specifically mentioning that have fluoride, have. The word mineral can mean a lot of things, not necessarily fluoride. So if you want patient to have more fluoride, you should ask her, you know what, you can continue to drink bottled water, but you have those bottled water which mention the term fluoride in them, and teach her to see that it has at least 1 ppm of fluoride. So that becomes your answer. Understood? So yeah, I have a lot of questions incorporated from Sjogren syndrome in my Ultimate ADC book as well. You can find the sample copy of that book by emailing me, and I'm really glad ADC has released questions like these, so you know what you are going to expect in your exam, and when you start solving, and you mark your answers wrong, and when you go through this video and realize how you have to solve the questions, and then a switch inside your brain opens up and says, oh yeah, this is how you're supposed to solve the questions, you'll thank me, and that is when I'll say welcome. I'm here to help you out, and have a nice day. Keep studying. These are really good questions. Do practice on them as much as you can. Go through these topics, very good topics. Actual exam questions were like these only exactly. So study on more on these topics. If not anything, you will become a better clinician anyways. So yeah, always happy to read comments from you all. You can write on my YouTube channel in the comment section, or you can just email me on adcwrittenmocktest@gmail.com. Alright, have a nice day. Bye bye.